So you've brought a new cat or kitten home. That's fantastic. And if you're watching this, you're already on your way to being an amazing pet parent. This explainer is all about giving you the insider info you need to handle one of the most common health hurdles, parasites. Our goal is to make you your pet's best advocate, and we're going to start with a story that shows you just how vital that job is.
Let's kick things off with a story about a little foster kitten named Daisy. This quote really gets to the heart of why we're talking about this. See, a simple lack of information led to a whole week of suffering for her, not to mention wasted money on treatments that didn't work. Daisy's story shines a spotlight on this gap in standard vet care that you, as the owner, can help fix just by knowing the right things to ask.
Okay, let's dive right into the #1 reason new kittens and cats land at the vet. Diarrhea that just won't quit. I know, it's stressful for you, it's definitely stressful for them, and the first step to making it stop is to understand who the invisible culprits usually are.
So let's meet the usual suspects, the big 4 internal parasites. First up, coccoxia, which often causes this really nasty yellowish diarrhea, especially in young kittens. Then you've got giardia. Its trademark is a pudding-like, super smelly stool. Roundworms, they're the ones that can give your cat that classic little potbelly look. And finally, tapeworms. You'll often know you're dealing with them if you see little things that look like grains of rice in their poop. This is your go-to symptom guide.
But you know, it's not just about what you see in the litter box. You gotta pay attention to their behavior too. And with giardia, there's this really weird but surprisingly common clue. A cat who's been a total angel with the litter box might suddenly start having accidents right beside it. If you see that happening, especially with that sticky diarrhea we just talked about, giardia should be at the top of your list.
Okay, so you've done the right thing. You've called the vet, you've described the symptoms, they're going to suggest a fecal test. Sounds simple, right? But this moment right here is the first critical fork in the road where your knowledge can change the entire outcome. Because the standard test they offer, well, it often misses the mark.
And here's why. The standard test, the fecal flotation, is cheap. And that's because it's literally a technician looking for tiny parasite eggs under a microscope. It's really easy to miss them. The PCR test, on the other hand, is a whole different ballgame. It's not looking for eggs, it's looking for the parasite's DNA. It's way more sensitive, way more accurate. Think of it like this. The first test is like looking for a needle in a haystack with your bare hands. The PCR test is like using a powerful magnet.
So, here's the bottom line. Your main takeaway for this section. Don't wait around. If your cat has diarrhea that's dragging on, don't waste your money or your cat's comfort on a test that could come back with a false negative. You need to ask your vet directly, by name, for a fecal PCR panel. It'll save everyone a ton of grief and get you to the solution so much faster.
All right, so you've advocated for the right test, and you've got a clear diagnosis. That's huge, but you're only halfway there. Now we have to talk about getting the right medication because, you guessed it, just like the tests, not all treatments are the same.
This is a classic pitfall. Your vet says, we'll give him a dewormer, and you think, great, problem solved. But hold on. You have to ask this one very specific question. A lot of people think dewormer is a catch-all, but many so-called generic dewormers only target one kind of worm, leaving the real culprit to continue its dirty work. And here's a perfect real-world example. A vet might give you Droncit. It's cheaper, and it only kills tapeworms. But what if your kitten has roundworms, which are way more common? Well, you've just paid for medicine that does absolutely nothing, and your poor kitty stays sick. An option like Drontal, which is broad spectrum, is often what you really need.
Let's go back to little Daisy's story. This is exactly what happened to her. She got the right diagnosis, coccidia, and the right first medicine. She even started to get better. Everyone breathes a sigh of relief. And then, 10 days later, bam, the diarrhea is back and it's even worse. This happens all the time with tough coccidia cases, because one round of medicine just isn't enough to beat its life cycle.
For these stubborn cases, there's an old-school protocol that's brilliant because it outsmarts the parasite. You treat for a week, which kills the active infection. Then you stop for a week. Why? To let any of the unhatched eggs, or oocysts, mature into the next stage. Then you hit them again in week 3 to kill that new generation. It's a cycle of treating and breaking that can finally wipe out the infection for good.
And now for a real pro tip. This is where you go from being a good cat owner to a superstar advocate. There are newer, much more effective medications out there, like Marquis Paste. It can often knock out coccidia in just a couple of days. Now, it was technically made for horses, so a lot of vets don't just have it on the shelf. But you can and absolutely should ask if they can order it for you. Okay, we've covered all the nasty things that can happen on the inside. Now let's switch gears and talk about the pests on the outside. Fleas and mites might just seem like an itchy annoyance, but for a tiny kitten or a sick cat, they can be seriously dangerous.
And I mean that literally. That is not an exaggeration. The story behind this comes from a tiny foster whose white fur was so covered in flea dirt, which is just digested blood, that she actually looked like a calico cat. A really bad infestation means thousands of little bites, and that constant blood loss can cause fatal anemia fast.
So what's your best weapon in the war against fleas? Let's look at the top 3 spot-on treatments, the little liquid vials you put on the back of their neck. Frontline and Advantage are solid choices you can get over the counter, but really the gold standard is Revolution. You need a prescription for it, but it's an all-in-one powerhouse. It kills fleas, prevents heartworm, and even treats ear mites and some internal worms.
Now, here's a super important safety tip learned the hard way from a very flexible cat named Buddha. You put these treatments between their shoulder blades, right? The one spot they can't reach to lick? Well, guess what? Buddha could reach, and he had a pretty scary reaction to licking it. The lesson is simple. After you apply the medicine, just hang out and watch your cat for half an hour to make sure they don't ingest it.
So what happens if you do see a reaction? Maybe their skin gets red or they're scratching like crazy. First thing, don't panic. Here's your checklist. Watch the area right away with some mild soap to get the chemicals off. Then give your vet a call for advice. It might just mean your cat is sensitive to topicals, and switching to an oral flea pill is usually a really simple fix.
The other big external pest you'll run into is ear mites. The signs are pretty obvious once you know what to look for. Your cat will be shaking its head constantly or scratching its ears like crazy. If you take a gentle peek inside their ear, you'll see this dark, gritty junk that looks exactly like used coffee grounds. The good news? A treatment like Revolution usually clears it right up.
Okay, so after hearing about all these creepy crawlies, inside and out, you're probably asking yourself, should I just be giving my cat preventative medicine all the time? And that's a great question. The answer, though, isn't a simple yes or no. The best strategy really comes down to your cat's specific lifestyle.
Really, it's all about risk assessment. If you have a cat that lives 100% indoors and has zero contact with other animals, their risk of getting parasites is incredibly low. For them, you can just treat problems as they come up. But if your cat goes outside, or even if you have a dog who brings the outdoors in, their risk is much higher. For that cat, a regular monthly prevention plan is absolutely the way to go.
And look, this isn't just a theory. This approach is based on direct, hands-on experience with more than 60 foster cats. And what you learn from that is that healthy adult cats, their immune systems are pretty tough. They can often fight off a little bit of exposure to these common parasites all on their own, without us having to do a thing.
And that brings us right back to the central theme here, the big question you should be asking yourself. Are you just your cat's owner, or are you your cat's advocate? See, being an owner can be passive. You give them food, water, a place to sleep. But being an advocate, that's active. It means taking this knowledge, asking the right questions, pushing for the better tests, and making sure your cat gets the best treatment, not just the easiest one. It's about being their partner in health.